How can we collect brain disorder biomarkers less invasively? How can we collect brain disorder biomarkers less invasively? This question is becoming increasingly important as we look for ways to diagnose and monitor brain disorders without resorting to more invasive methods. Traditionally, collecting these biomarkers often involves procedures like lumbar puncture, which can be uncomfortable and carries certain risks. Fortunately, there are several innovative approaches that researchers are developing to make this process easier and safer for patients. One promising method is the use of blood-based biomarkers. Blood samples provide a less invasive alternative to cerebrospinal fluid collection. Recent advancements have made it possible to detect proteins and other molecules related to brain disorders in blood. This is particularly exciting for conditions like Alzheimer's disease, where early detection can lead to better outcomes. While the blood-brain barrier can limit the types of molecules that enter the bloodstream, ongoing research aims to improve the sensitivity and specificity of these tests. Another interesting avenue is the use of saliva and buccal cells. Collecting samples from saliva or the inside of the cheek is simple and painless. These samples can be taken repeatedly, making them ideal for ongoing monitoring. Although research in this area is still developing, the potential for using oral samples as biomarkers is promising. Urine samples representing another non-invasive option. While urine contains fewer proteins compared to blood, it is the easiest biofluid to collect. This makes it a highly accessible source for future research into brain disorders. Although there is still much to learn about urine biomarkers, it is a field worth exploring. Advanced imaging techniques also play a role in non-invasive diagnostics. Magnetic resonance imaging, or MRI, can identify chemical biomarkers associated with brain disorders without the need for surgery. For example, specific metabolic signatures linked to epilepsy can be detected through specialized MRI scans. This allows for precise localization of abnormal brain regions without any invasive procedures. Lastly, non-invasive brain stimulation techniques, such as transcranial magnetic stimulation and transcranial direct current stimulation, can provide functional biomarkers. These methods assess brain activity and can help identify changes related to various brain disorders. They offer a way to gather information about brain function without the need for surgical intervention. The trend in neurotechnology is clearly moving towards combining these less invasive methods. By integrating fluid biomarkers from blood, saliva, or urine with advanced imaging and brain stimulation techniques, we can achieve more accurate and earlier detection of brain disorders. This approach aims to reduce the reliance on invasive procedures while improving patient comfort and safety in diagnostics.